Hi, friends. I am Dr. Zainab Vora, and I have with me Dr. Siddharth, who's cleared his DNB Practical Exam. So, congratulations, and tell us about yourself.
Thank you, ma'am. I'm currently based in Bhubaneswar and I've done my DNB from Manipal Hospital, Bhubaneswar.
Uh-huh.
It was Amri when I joined, then Manipal took over. Now it is Manipal.
Okay. So, how was your
So
experience of the last 3 years?
and when I joined, I was the first batch here. We did not have any seniors.
Okay.
So it was a risk and
Yeah.
consultants were very good actually.
Mm.
They were very supportive. They were seniors and consultants both,
Mm.
and they taught us very patiently.
Yeah.
So that was needed from them.
So, how
And
was the patient load? I mean, just being a few of you must have been very difficult to manage the reporting.
Ma'am, when we joined, there was no residency culture as such.
Hmm.
But they started giving us the hands-on from first month itself. So
Yeah.
ultrasound, we had about 100 cases. And
Okay.
what good thing about when we joined was we had antenatal scans. We could do
Mm.
TVS, we could do abdomen, everything else,
Yeah.
truss also. So that was a good thing. And now it has shifted a bit. We do not have antenatal scans here right now.
Okay.
So now the caseload is at such 100 to 110 ultrasounds per day. And CT we have around 30 to 40 per day. And MRI, I think 10 to 15, 20. It is gradually increasing right now.
Yeah. So,
So
that's a
that
very
was
good.
the average number.
Yeah, a lot of
Yes, ma'am.
exposure that means, for residents, and particularly since there are no other residents, just JRs, right? No SRs.
Yes, ma'am. Yes, ma'am.
Okay, so then there's a lot of exposure then. So you must have learned a lot through reporting, but it must have
Yes,
been a
ma'am.
struggle initially because you don't really understand what you are, doing and what you're seeing. So, tell me, how did you manage preparation while, managing your residency, and how did Conceptual come into all of this picture? How did you use the app? How did you find the time to, study amidst the duties?
So I took the conceptual subscription in the late second year,
Hmm.
towards the second half of my second year. So before that, we had whatever exposure we have had in ultrasound and cross sections. So our consultants used to guide us,
Hmm.
and so the first and the residual learning experience, the most important vital learning experience comes from the cases.
Yeah.
So even if we see one positive case, if we see one GB mass that is infiltrating liver, so you have to read GB mass either from a book, either from Granger or Goran Levine or articles. Mostly I used articles and journals to refer to cases as and when they come in.
Yeah.
So if some cases come, if we have a difficogram study in a hospital, so if it is the first time I'm seeing it, then consultants used to ask to read some articles regarding it.
Hmm.
So 2 years. So after I took the subscription, when I started preparing for the examination as such,
Yeah.
for the theory examination, the first yardstick was the DNB previous year question paper, the last 5 year papers. So according to that and the conceptual also whatever topics are covered, so we get an idea of what are the important topics, what are the important questions we can expect.
Yeah.
So according to that, from that yardstick, you can gauge that these questions I know, these questions I don't know.
Hmm.
For example, in MRI, some ankle impingement syndrome is there. So if you can see that this is totally new for me and I have to study it. You may have studied shoulder impingement, that is a different thing. But if some questions are completely new, you can start from those topics first. So
Correct.
conceptual is a very good baseline, the notes and the videos. It is a
Mm.
very good starting point for anyone. If you're
Mm.
totally new, you don't know where to start from, what are the sources, you
Yeah.
can totally relate to the videos and the notes and you can get the gist from the topic and then you can refer to other books or articles. That was the
Yeah, so you would basically use it as a checklist of the things that you had to finish,
yes ma'am.
and
Yes
whatever
ma'am.
you could do from the video, you would do that, and then you would add on information from different sources onto that
Yes
thing.
ma'am.
Because yeah, I mean, in residency, the approach is never कि इतना ही पढ़ लो, वो ही काफी है. It's for
uh,
it's lifelong. You will keep adding and you will keep learning stuff. So it serves as a good base of understanding, and then you can there's no end to adding information onto that. And that is the idea also, to give beginners a gist of the topic, and then they can keep on learning, seeing cases, because the best teacher is what, the case that you're going to report. When you report, you see more and more findings, and that's how you're going to eventually get better. So great. If we can talk about how your exams went, theory, practical, what was the experience? What is it that you would tell a junior now, who, let's say, has an exam 6 months later? What would be the roadmap for 6 months? Because that's probably the only time that you seriously, get to prepare for an exam.
So if you have an exam 6 months down the line, first prepare a yardstick, like I said, list out the
Hmm.
topics that you have to study,
Yeah.
and define some timelines. You have to define some timelines that this month I'll be done with
Yeah.
this system, and
Yeah.
whatever I have done, I'll move on to the next system from the next month. So
Correct.
that should be the first thing, and you have to start writing the answers,
Hmm.
because you actually have to start writing the answers, because this is very important. People may not realize it, but 4 days of continuous writing for 3 hours,
Yeah.
even if you know the answer, the uh, exam writing skills and answer preparing skills, those are very different things.
Yeah.
So if possible, if you get the time, start making your own notes, concise notes,
Yeah.
that you can refer before exams, because you won't have much time to refer between the papers. It
Hmm.
is 4 consecutive days, so there's a lot to cover. And start preparing paper 4 from the 6 months before your 6 months gap. When you are starting, start with the paper 4.
Yeah.
um, that
Which
is a
is
very
physics
difficult
and
physics,
recent.
and yes ma'am, recent
Recent.
advances, because that is completely new for us. Let's say
Yeah.
paper 2 and 3, you are exposed to something through your cases, through your residency, you know something about, at least something about all the cases.
And-
But paper 1 and paper 4 are a bit difficult,
Yeah.
like CNS, head and neck, MSK,
Hmm.
physics, all these you have to start preparing from an exam perspective.
Yeah. Yeah.
This
And
is for the theory.
yeah, yeah,
Yes
yeah,
ma'am.
yeah. That's what I was asking. What about the practicals?
So for the practical exam, after the theory is done, you will get a hang of what are the important topics that
Hmm.
can be expected as long questions or long cases. So you can prepare a list of this, but it is very variable. You know, the examiners can ask basically anything.
Hmm.
My long cases were UIP and intraventricular mass.
Okay.
So in UIP, the
Intraventricular
examiner,
mass in the brain.
yes ma'am,
Hmm.
anyway.
Yeah. Okay.
Brain tumors. Yes, ma'am. So in the UIP case, the examiner straight away told me, you know, this is UIP. I know this is UIP. We're not going to talk about UIP. So then he started going into HRCT basics. So
Yeah.
that is where, if you have studied the first chapter or second chapter of web,
Yeah. Yeah.
you can clear it through. So all about your basics. If you keep your basics strong, then you'll be through.
Right. So essentially, you worked very hard during your residency, a lot of exposure of cases, and then when you add on, and you seem like a very sincere student who's read a lot. So I think that all adds up towards the end. There is no
Yes, ma'am.
sprint towards the exam. This is what is marathon.
Exactly.
Everything that you've learned in your 3 years comes handy during the exam, right? Each and everything counts in the end.
Yes, ma'am.
So yeah, so that is what is evident. Anything else that you want to add?
This is one thing that no matter what, the same thing that you were saying, I'll reciprocate it. The same thing that it doesn't matter what you do in the last 1 or 2 months. Eventually, whatever you have done in the last 3 years, that residual knowledge, only that thing comes to rescue during the exams.
Yeah.
Only that can get you to pass your exams eventually.
Yeah. So
That is
be
very important
sincere,
too.
be a sincere resident. Whatever you are reporting, go back and make sure that you are studying that and finishing it then and there. Don't leave it for later, because that's not going to happen. So when you are reporting, study that topic and then move on to the next. That's how you keep expanding your, knowledge base. So whatever case, as
Yes,
junior
ma'am.
residents, first year, see the video of that particular topic from CR, and, just read any article and then go back to reporting it. So that gives you more perspective, and that's how you'll eventually get better. So yeah, that is what is our collective suggestion. And thank you so much, Dr. Siddharth, and many congratulations to you.
Thank you. Thank you.
Thank you. Bye.